Hey everyone. So we've been asked many times to describe the concept of joint dissociation. So we're going to do that here briefly in this video, and we're going to do this within the context of the hip joint. Now, when we're describing dissociation, we like to characterize dissociation more so as segmental dissociation as opposed to joint dissociation, okay? Because dissociation really represents the capacity of interacting segments. So let's look at the femur relative to the pelvis here. Can the femur move relative to the pelvis? Can those neighboring segments move relative to each other? Okay, so if we look at the femur, can the femur internally rotate and externally rotate without the pelvis moving with it? Okay, which would represent a lack of dissociation. Okay, and that capacity for the femur to move relative to the pelvis is important because if that femur can move relative to the pelvis, then we have more space for that femoral head to move through, which means that we have more options to spread pressure locally around that interaction, which means that the associated muscular tissues that connect those individual segments can also lengthen and shorten more and spread pressure more locally, okay, to give that local interaction more options to share and distribute stress. So we're looking locally as opposed to globally across the whole lower limb now. Okay, so this is important when we're looking at restoring local dissociation or local variability between two interacting joint segments. Okay, we like to describe that more as segmental dissociation because sometimes you'll hear therapists talk about hip dissociation. Okay, but when you're talking about hip dissociation, do you mean the pelvis or do you mean the femur? So it can be quite confusing when you describe the joint behavior. We find it much better and gives the therapist much more clarity when you describe segmental behavior, okay? And that also helps us understand what kind of loading strategies, exercise strategies, manual loading strategies might the client need to restore variability locally, okay? It also gives us a bit more clarity in understanding how we can progress and regress exercises too. It's also important to consider that segmental dissociation is just one feature of many features that characterize variability across the movement system. It's not the only thing that we should be working towards, but it is an important feature, okay? So when we look at the research that describes the interactions between the pelvis and the femur, what you'll see in the research is the interactions between the pelvis in the sagittal plane relative to the femur in the transverse plane, or into rotation. And what you'll typically see is that when the pelvis moves into extension or a posterior pelvic tilt, that will naturally drag the femur into external rotation. Okay, so that's not a representation of dissociation. That's a representation of the pelvis dragging the femur into external rotation. Okay, so they're moving in the same direction. That's not dissociation. Okay, if you look at some coordinated research, that might be described as in-phase movement, not anti-phase movement. Anti-phase movement is the same as dissociation, okay? You'll also feel this in your own body. If you're in standing and your feet are planted on the ground and you posterior tilt your pelvis or extend your pelvis, you may naturally feel the pressure shift to the outside portion of your feet and back towards the heel, because when that pelvis posterior tilts, it'll drag the femur into external rotation, which will bring the weight distribution laterally. And you'll see the opposite with pelvic flexion or an anterior tilt of the pelvis, which will drag the pelvis into more of an internally rotated position. But it's not relative femoral internal rotation, it's just the pelvis dragging the femur into the same direction, okay? So it's really important to consider that. And it also works both ways as well. When the femur externally rotates, it can drag the pelvis in the same direction. It has the capacity to do that, but it should also have the capacity to move in the opposing directions, or it should also have the capacity to move in one direction without the pelvis moving in that direction as well, okay? So what would represent dissociation here is the capacity of the pelvis to extend a posterior tilt as the femur can internally rotate. Okay, and on the opposing end of the spectrum, the pelvis should have the capacity to flex as the femur externally rotates. Those are opposing directions, opposing motions. Okay, and where this is typically seen is when you look at femoral flexion, or when you're measuring femoral flexion, or when you're measuring internal rotation. So if we're looking at femoral flexion, we're measuring the capacity of the femur to move towards the chest, which we want to get to. In order to get the femur towards the chest, the pelvis has to posterior tilt to afford more space for the femur to move through. If you were to anterior tilt or flex your pelvis, you're going to reach a block in that femoral movement around between 90 and 120 degrees, okay? But at around 120 degrees, as we move that femur through the sagittal plane, that pelvis should extend or posterior tilt to afford more space to move through, okay? But what you'll often see in clients when you're measuring femoral flexion, I'm sure many of you've seen this before, as you're flexing the pelvis or as you're flexing the femur and you're trying to keep the femur in the sagittal plane, what you may feel is a restriction. And the only way you can get that femur further through flexion is if you bring it into external rotation and abduction, okay? Or you might ask a client to bring their knees to their chest and they'll actually naturally bring the femurs into external rotation and abduction, okay? And oftentimes where they're doing this, and again, this is just one of many reasons, is because they're using that femoral external rotation to drag the pelvis into extension or posterior tilt, okay? And this can be, done to maybe get some relaxation in the lumbar spine, for example, or get some lengthening through the lumbar extensors. Because when the pelvis can extend, it can facilitate a relaxation or an eccentric behavior through the lumbar extensors. So in order to get that pelvic extension, they may externally rotate the femur to facilitate that pelvic movement into extension or posterior tilt. But that would not be a representation of dissociation, okay? What would be a representation of dissociation is if we can keep that femur in the sagittal plane and still allow that pelvis to extend, okay? Or if we look at femoral internal rotation, can that femur internally rotate while the pelvis extends, okay? Because as the pelvis extends, that would naturally try and drag the femur into external rotation. But what a lot of the research also shows us is that when the pelvis extends, it affords a lot more space for that femur to internally rotate into, okay? So it's also a very important feature to represent more variability between the femur and the pelvis, okay? And again, like I said, this is just one of many features that we can work towards, but when it comes to looking at femoral and pelvic interactions, this is a really important feature, and restoring that capacity of the femur to flex but stay in the sagittal plane without having to move into external rotation and abduction is an important one. And you may see a lot of videos on our YouTube or on our Instagram page that work towards facilitating this capacity of the femur to move through flexion and stay in the sagittal plane, okay? So just one of many representations of dissociation, we're using the hip joint here, which represents the interaction between the femur and the pelvis. It can, I'm sure, kind of appear quite confusing, but once we understand the natural coupling behaviors between interacting segments, it can be much easier to understand what positions we may have to get the client into, what directions we may have to produce force into, what type of position may we have to get into to facilitate an eccentric behavior through the glutes, for example, or to facilitate a concentric behavior through the hip flexors, for example. We need to understand how the segments are interacting with each other to facilitate those movements, but also to challenge those movements, okay? So when we're trying to challenge those capacities, the capacity to flex the femur in this scenario, we want to be able to keep it in the sagittal plane. But the reason it is challenging is because naturally, as the pelvis extends, which it needs to get through full femoral flexion, it will try and drag the femur into external rotation. So it would represent a greater challenge to keep that femur in the sagittal plane. So when the pelvis extends, that femur would naturally be relatively internally rotated and adducted relative to the pelvis, okay? So like I said, just one representation of variability across the movement system by looking at segmental dissociation.